Hello student, today we will discuss about new chapter, so that is male genitourinary disease and disorders. So before we could move on any disease or disorder, let we have or brush up anatomy and physiology of the system. So last year you have studied, if you know very well about anatomy and physiology, it is very easy to understand the disease. So urinary system is one of the excretory system of the body. Excretory means it helps to put the waste product out in the form of urine. So it consists two kidneys which helps to secrete urine, two ureter conveys urine from kidney to urinary bladder, means it carry urine from kidney to urinary bladder, and one urinary bladder where urine is collected temporarily, and one urethra through which urine is discharged. So organ of male reproductive system. So in a picture you can have a look every organ. So two testes, two epididymis left and right side, two vas deferens duct left and right side, two spermatic cords are there, two seminal vesicles are there, two ejaculatory ducts. In a picture you can have a look, one prostate gland and one testis. Okay, now let me move on a minor disorder to major disorder. The first minor disorder is a orchitis. The prefix orchi means testis, the suffix tis means inflammation. So orchitis is a inflammation of the testis. So in a picture you can see how it is an inflammation of the testis. The area, entire area, the scrotum is become swollen. The redness you can see here. Okay, what are the causes? It is always, the orchitis is always secondary. Secondary means it occurs due to some other, means already the client is suffering with a bacterial, viral or a other disease. So as a complication of that, the client is getting inflammation of the testis. Occurs after an episode of bacterial or viral infection such as mumps. Mumps is a viral infection. It will infect the salivary gland. Pneumonia is an inflammation of the lungs. And TB, you know, tuberculosis. Syphilis is a sexually transmitted disease. And influenza is a severe form of lungs infection. And also it occurs as a complication of epididymitis, inflammation of the epididymis. Later you will study. Prostatectomy, removal of the prostate gland. It is a surgery. So as a complication, it will infect the testis. Any injury or a trauma to the testis. Catheterization procedure, as a complication, infection will occur. UTI, urinary tract infection. So these all are the main causes for orchitis. So what are the signs and symptoms? So you can see in the pictures. So there will be a testis is painful. So you can see there in the picture how it is a tenderness. You can see like it is a swollen. If it is a swollen means, of course there will be a pain will be there. So the redness is due to inflammation. So what are the management? Since it is an infection, it will be inflammation. It is treated with the antibiotic, and to reduce pain, analgesic, and it required bed rest with the scrotum is elevated on an ice pack. Ice pack will reduce the swelling as well as reduce the pain. So hope you understood. This may ask for 1 marks or a 2 marks. Okay. Next we will move on one more minor disorder, that is a hydrocele. Hydro stand for water, cele means collection. So hydrocele means it is an abnormal collection of fluid in the scrotum. Usually in a scrotum water will not be there. The scrotum will cover the testis, protect the testis. Inside water will not be there, but here the abnormally the fluid will be collected. But this abnormal collection of the fluid is common in an infant than adult, but it will occur in adults also. So you can see in a picture, this is in adults and this is in a child. So usually this often go away on their own, but sometime it may not. Okay. So what are the causes for hydrocele? The major cause is result from interference with lymphatic drainage of the scrotum and swelling of the tunica vaginalis that surround the testis. So interference with lymphatic drainage. See, our body is covered by lymphatic system. So lymphatic system is immune providing system. So in a lymphatic system, lymph fluid will be draining, moving, flowing throughout. So if any blockage in this lymphatic fluid, what happens? It cannot move forward. So it will block there only. So the same thing will occur in a scrotum. Due to the blockage, it cannot move forward. So due to that, the excessive fluid collection in one particular area, the enlargement of the scrotum will take place. So due to that enlargement, swelling of the tunica vaginalis. What is tunica vaginalis? Tunica vaginalis is a outer covering of the testes. So the swelling of the tunica vaginalis will takes place. What are the signs and symptoms? See, usually it is a painless enlargement of the scrotum, but in some condition there will be a mild to severe pain will be there, and some kind of, since it is a going on enlarging, some kind of discomfort, irritation will be there while walking. If it is in a children also, or if it is an adult also, while walking, it kind of a discomfort will be there. So if it is very small, just watchful waiting is required, the treatment modality. So by itself, as I told, it will resolve. But if it is a day by day, the swelling is increasing, the fluid collection is a more means, it requires surgical drainage, that is under local anesthesia. So after this procedure, client may discharge. Only 1 day is required, only 1 day admission is required. Client is instructed avoiding strenuous activities as well as a sexual act for the 2 weeks, and avoid bath until area is healed. If he is bathing, he can, but he has to take care. After the bath, he has to clean the area and he has to cover that drainage site with a gauze. If it is in a children, means it is a parent's responsibility. Children has to, the parents has to take care. After every toilet, the parents has to clean the area, and the area has to covered with the gauze. So here we 2 minor disorder we completed. So remaining we will see in a next video. Thank you, student.